Admit na tayo, Gerard.
Yes po, mag-admit na po kayo ng participants. Para kapagsimula na po tayo. So, good afternoon everyone po. Magsisimula po yung webinar proper at 1 p.m. Kung gusto niyo na po kumuha ng tubig, ng snacks, or pumunta po sa CR, now is the time po bago po magsimula. Pwede din po pa-mute ang inyong sarili kung naka-ano po kayo para po hindi ma-interrupt yung ang webinar experience.
We are mag-check lang sa audio. Number of slides.
Magandang hapon po. 5 minutes po bago magsisimula yung webinar. 5 minutes po. So kung gusto niyo na po kumuha ng tubig or mag-CR, now is the time po. Again, we will start at 1 p.m. sharp po. Hi.
Sir Gerard, andito na rin si Dean.
Apo. Hello po, Dean. Okay po, gawin po kayong co-host. Good afternoon po, Dean. Pwede po pa testing na po inyong mic saka video.
Hello.
Yun, sige po. Afternoon po. Salamat. Simula po tayo in 2 minutes. Okay po, last minute na po. Kung may last minute po kayong kukunin or gagawin, now is the time. But otherwise po, magsisimula po tayo ng 1 p.m. sharp. Okay. So, magandang hapon po. Welcome everyone to the 6th edition of this webinar series, Rising to the Challenge of the Pandemic, LGU Best Practices in COVID-19 Crisis Management. This webinar is brought to you by the Center for Local and Regional Governance ng UP-NCPAG in partnership with the League of Vice Governors of the Philippines. As new strains and complications with the virus surface in the country, it points to the need for local government units to do more. Meet these challenges unrelentlessly as we try to deal with a new sense of normal. It is exactly within these adverse conditions when we need well-informed and effective policies the most. These are the times where we look to our leadership to inspire their citizens to cooperate and keep on charging ahead against the problems caused by the coronavirus. This series serves as a platform for local leaders to share their COVID response experiences and as a means to share and discuss your citizen ideas with one another so that we can collaborate and think of ways to better improve our response as a nation. My name is Gerard, a researcher at CLRG, and I will be your MC this afternoon. Joining me in providing this webinar experience are my fellow researchers from the center, si Ms. Sally, si Ma'am Lou, si Ma'am Ann, si Ma'am Becky, si Ms. Patty, saka si Sir Bridge. Should you have any technical concerns during this webinar, please feel free to ask them through the Zoom chat box. Before we begin, let me just go over some protocols and reminders that we should be mindful of. So, in case lang po sa mga tao na nahihirapan ng kanilang audio, please type it now in the chat box. Next po, Sir Bridge. Tapos ito po yung mga troubleshooting advice. Dalawa pong next, Sir Bench. Isa pa po. Ayan. So, ito po mga protocols and reminders lang po before we begin our webinar. Para po manatili yung magandang discussion natin at wala pong ma-interrupt na speaker, please put yourself on mute. Saka please turn off your camera po unless you are advised by any one of the staff to open. This webinar is being recorded for documentation purposes. By participating in this webinar, you are agreeing to be recorded by us. Tapos lastly po, sa mga naghahangad ng certificate at presentations, participants who have completed 70% of the total webinar time and submitted the feedback form after the webinar will receive certificates of participation and copies of the speaker's presentation 1 week po after this webinar. Okay, next po. Alright. Tapos, at any point po during the speaker presentation, you may send your questions via this format. So, ilagay lang po ang inyong buong pangalan, ang inyong institutional affiliation, at inyong question dito po sa chat box. We will try to answer them during the open forum po. Tapos, yung mga speakers na gusto pong sumagot ng katanungan nila, pwede po kayong sumagot sa katanungan nila sa chat box mismo. So, as of yesterday po, mga 160 people have registered and joined this webinar, mostly composed of students and local government officials. At marami pong salamat sa continued interest niyo in this webinar. So, to give an overview po of the program, our program will first begin with an opening message from the Dean of NCPAG, Professor Dan A. Sagil. His message will be followed by Attorney Catherine C. Agapay, the Vice Governor of Laguna and the National President of the League of Vice Governors of the Philippines. Then we will move on to the presentation proper, which will be moderated by me. Our webinar today has 3 speakers. They are Mayor Kirk A. Asis of Bayugan City, Agusan del Sur, Mayor Lisel Mondejar Sevilla from the Municipality of New Lucena, Iloilo, and Mayor Nervi Santos Martinez from the Municipality of Talavera, Nueva Ecija. Their presentations will last up to 20 minutes each, and they will then be followed by a 20-minute reaction from Vice Governor of the Province of Sarangani and the Vice President for Mindanao's League of Vice Governors of the Philippines, Vice Governor Elmer T. De Peralta. In order to better facilitate the time, remind po ako kung kailan malapit na po matapos yung ano. So, speakers, please just, kung may narinig po kayo sa akin, that means try to wrap up your thoughts po. Okay. After the reaction, we will finally have the open forum to answer the questions participants have submitted during registration. At any time during the presentations, muli, at any time habang ongoing po yung presentations, kung may katanungan po kayo, please ask them on within the chat box. And speakers, if libre po kayo at gusto niyo pong sagutin right then and there, you can answer via the chat box din po. Okay, the open forum will last around 30 minutes. So pinili po talaga namin yung mga questions ninyo based on the questions that you have given us during the registration period. Lastly po, ang ating course manager po, si Tita Selly, ang magbibigay po ng closing and magbibigay po ako ng final remarks at the program. Okay. With that po, maraming salamat po sa pakikinig sa aking overview. Dean, pwede po ako makihingi. May I kindly request that you give us your opening message, sir?
Thank you very much, Gerard. Magandang hapon po sa ating lahat and welcome to this 6th edition of the webinar on Rising to the Challenge of the Pandemic, LGU Best Practices in COVID-19 Crisis Management. I would like to start by wishing you and your families my best for your health and safety in this time of the pandemic. I would also express my gratitude to the officers and members of the League of Vice Governors of the Philippines and the Director and staff Center for Local and Regional Governance for hosting this event. I'm very happy for your continuous hosting of exercises such as these to share knowledge and experiences in managing public affairs. This webinar is an opportunity for us to learn, discuss thoughts, network, and share and create ideas. Benefits in joining this webinar may differ for each of us, but through this exercise, we continue to expand our professional and personal development and are provided with information that we may not be able to generate from within our organizations. Despite improvement in statistics on COVID-19 pandemic response, it continued disruption of or threat to the operations of organizations from family to businesses. A crisis like this requires quick thinking in the face of uncertainty. However, with such high stakes on the line, there are still those who themselves dealing with analysis paralysis or the inability to make a decision through overthinking. The knowledge and experiences we learn from one another will help us make well-informed decisions about policies, programs, and projects by putting the best available evidence. This approach stands in contrast to opinion-based policy, which relies heavily on either the selective use of evidence like using single studies, irrespective of quality, or on the untested view of individuals or groups. This disease outbreak affects girls and boys, women and men differently. Children's education was interrupted, protective structures disrupted, and families and communities placed under stress by health and economic burdens. There is also risk of psychological distress at times of crisis, as well as increased risk of violence, abuse, exploitation, and neglect. LGUs are very important for every heterogeneous societies. It brings the government nearer to the people, allows for popular participation in the conduct of public affairs, acts as a two-way channel of communication between the local population and the national government. As such, LGUs are well situated to respond to the impacts of COVID-19 at the community level. Fortunately for us today, we have resource speakers who have first-hand information and experience in managing COVID-19 in their respective areas. Using what they have already learned and created can save time and resources, increase our productivity, and minimize risk. We hope that this exercise will be an effective exercise for sharing information to support and promote COVID-19 response by generating relevant and up-to-date information and sharing of experiences. I am certain that PLRG is more than willing to provide assistance to you. I sincerely hope that the lessons learned in this webinar will assist all of us as we address the COVID-19 scourge. Before concluding, allow me to thank our speakers, the Honorable Mayors Kirk A. Asis of Bayugan City, Lisel M. Seville of New Lucena in Iloilo, Neribi S. Martinez of Talavera, Nueva Ecija, and our reactor, Vice Governor Elmer T. De Peralta of Sarangani Province. Many thanks to all of you, our participants, for your interest in this webinar. I trust that you will find this exercise to be a rewarding experience. Maraming salamat po at magandang hapon po sa inyong lahat.
Maraming salamat po, Dean. As always po sa magandang message ninyo. Now, may we go on to the message of Attorney Catherine C. Agapay, which is pre-recorded sa inyo po, to try and prevent internet disruptions. Ilalagay lang po namin yung video.
Fellow workers in the government, Dean Sayang, LVGP Chairman Attorney Boy Kimpo of Aklan, Vice President for Mindanao, Vice Governor Dr. Elmer De Peralta of Sarangani, fellow Vice Governors, our distinguished panels, and partners in governance, good afternoon. Welcome to the 6th edition of our webinar series on COVID-19 mitigation best practices. Salamat at nandito pa rin tayo to show our support in finding effective ways to end this pandemic. For more than a year now, we provided information, insights, and partnership to our LGUs through this webinar series para mapalawig ang ating kaalaman and learn from leaders who trailblazed the way. I am definite na marami tayong natututunan from the experiences of our panel. For this, I would like to sincerely express my gratitude to UP NCPAG, my fellow vice governors, and all the elected officials who shared their journey with us. Marami pa ang ating kinakaharap na pagsubok, but I am confident that we stand united in our effort, work together, revive our economy, and secure the health of our people. Hindi imposible ang tagumpay. A few days ago, President Duterte committed that by the end of the month, we will have completed inoculating 4 million individuals. DILG is also urging our local governments to be ready to administer 3 to 4 million jabs a month starting this June. We are very hopeful and we need to continue to trust that our government is working and doing its best to make sure that every Filipino is protected and safe. On the part of the LVGP, we have been conducting forums to present ideas that can stimulate economic recovery in our provinces. Kailangan nating bumangon kaagad to make sure that our economy is back on track the earliest possible time. I'm hoping that the presentations this afternoon will be eye-openers and give you ideas on how to contribute in your capacity as citizens or as government workers in our effort to bounce back from this pandemic. Maraming salamat, and again, good afternoon po sa lahat. God bless you.
Okay, that was po Attorney Catherine Agapay, National President po of LVGP. With that, pwede na po tayo magsimula. I would like now to turn the floor over to Mayor Lisel Seville to give her presentation on her experiences with COVID-19 and their LGU response. Ma'am, the floor po is yours. Ma'am. Seems may technical difficulties. Mayor Lisel? Ma'am? Okay po parang, sige po. Hello? Okay na po ba?
Hello. Hello. Good afternoon.
Good afternoon po.
Yes.
Ayun.
Okay na po audio test. Okay na tayo?
Yes po, rinig po kayo, ma'am.
Yes, okay.
Could you please turn
Thank you,
on your
Gerald.
camera po? Or,
Naka-off mo yung camera ko.
apo. Ay, sige po.
Okay na?
Okay na po, yun po. Okay,
Okay,
sige
thank
po, ma'am.
you. Thank you, Gerald. Good afternoon, everyone. Good afternoon po kay Professor Sagil and kay Attorney and to all the participants, government officials, vice governors, down to mayors, and the rest of the officials. So let me start with my presentation, just to give you an overview of the municipality of our profile. So our municipality is located in the central part of the province of Iloilo, and we have 21 barangays. Our population is 26,045. We have 5,545 households, and we are a municipality. Our area is mostly used for agriculture, 80% of it. And for the overall profile of the municipality in our cases, we have here the total number of cases, 91 cases since the start of this pandemic. Then we have cases of 20, total recovery 71, 0 death as of this presentation, as of the preparation of this presentation. And we have 2 OFWs, 9 LSIs, 1 APUR, and 79 local cases. So this is the overview of the cases in the municipality. And what we have done here, have the executive order number series of 2020, number 63. We created the task force against COVID-19, and this task force is the one in charge in the management of the COVID cases in our municipality. So that composed of the BHERTs in the 21 barangays, the People's Organization, BHW, BSPO, and of course our health personnel, disaster personnel, and the rest of the members of this task force. We also have made executive orders related to COVID management. So far, we have 8 executive orders that were done to address the COVID cases. And we also have created our Balik New Lucena Help Desk, which is the ones assist and monitor the arrivals of our returning OFWs, the SIs, and the authorized persons of residents. So this can be viewed by our constituency sa media account natin, sa Facebook, where they can see this one and then they just do their message. They can chat our administrators there and they can ask ano yung mga requirements, how to go back to New Lucena. And then we have assigned personnel tasked to answer to all the queries of our constituency for the systematic of the processing of the requirements in going back to New Lucena. Another thing that we have done is, of course, the management of COVID cases. Lahat naman tayo, we were all unprepared to this kind of pandemic, no? But we have tried our best doing quick contact tracing because that's one way to confine this. We also conducted swab testing and the strict quarantine isolation of those who are positive and those who were contacts of a positive person. So that's what we did. And for the challenges that we have encountered in the management of COVID, first is we have problems with the management of the returning residents because that was the first time. So the problem is, of course, limited yung transportation means nila. They Lucenanhons from other parts of the country communicated to us and they asked us on how they can go back to New Lucena. So the problems is what so we need to coordinate to other mga politicians na merong access that have access to other agencies na pwedeng maisabay o maidala yung aming constituency pabalik dito sa Iloilo. So we had maximized our connections and look forward for private partnerships pwede makasakay yung aming mga constituency para makabalik dito sa Iloilo, sa New Lucena. And another challenge is, of course, the limited resources. I think this is also true to other municipalities. So what we did at first was we realigned or reprogrammed our budget from the Quick Response Fund sa disaster and things from the previous years to augment the COVID response activities and the programs that we had. Yan yung fund na ginalaw namin. Kasi pandemic, there was already an order na we can use the funds, no, the quick response. And another challenge is the lack of quarantine facility. So we identified muna yung mga existing namin na mga centers dito, and such as the crisis center na wala namang laman, so we use that as an alternate quarantine facility muna. But of course, we encountered problem and challenge there because parang paano ba to, anong gagawin natin? No? Kasi we were not trained on how to do this. So what we did is with the help of the rest of the members of the task force, with the health personnel, our MHO, and our MDRRMO, we all agreed to use a certain facility and how to go about it to ensure the confinement of the cases. So that's one challenge, the facilities. And another is of course, with the very limited resources, no? So isa yon. And then the management of COVID positive patients na actually this picture is not a picture here in the locality of New Lucena. We just take this from the website just to show you that we have a situation, especially ngayon, that the hospitals are full and we only manage them in their houses. No? So we have one positive case here na minamanage ngayon sa kanilang bahay, no? With the supervision and monitoring of our municipal health officer. We provided the oxygen tank and the medicines, and the BHERTs are also there to continuously monitor. So kasi wala na hospital na available. So this is what the best that we can do right now is to manage them in their homes. So that's one challenge. And another is the ineffective learning modality for children. So our children with the new basic learning education that we have with the DepEd right now, yung modular type natin. So hindi lahat ng mga bata, even if it's not, we still have children na hindi nga makatapos at the end of the year, no? We have dropouts. So how much more with this kind of system na modular tayo ngayon? So what we did, we came up with the idea of providing them with a parang tutor or someone to guide them to ensure they're able to finish their module. So that's one challenge that we have encountered to the upholding of the rights of our children to development. Another challenge is, okay, so we go now to the strategies. No? So far, yun yung mga challenges talaga namin na and now what we did with those challenges. So in management of the arrivals of returning residents, we activated the Balik New Lucena Health. As I've said earlier, so may nagmaman tayo na tao dyan, 24 hours, just to address the needs, the questions, paano makabalik, what are the requirements, no, sa mga constituency. And we also establish linkages and partnerships in coordination with the Office of Civil Defense. They help us through, may mga vessel kasi na sa mga ano namin, sa mga LSIs namin. So it's good that they were also there to help us. And we assign our LGU vehicles to assist in the transportation of these LSIs arriving from the airport, from the ports, or kung saan man sa boundary man. No? So we have designated vehicles for that one. And another strategy to manage the arrivals of returning residents, we allocated budget for COVID transferations. Yan yung medyo kumakain na malaking budget natin because of the fuel needs, maintenance of the vehicle, disinfection activities. We hired additional personnel para matugunan ito lahat ang operation ng ating transport. And we also have issued a resolution there. And another strategy is in mobilizing our limited resources. Of course, we prioritize. Ano ba talaga ang need natin? Kasi ito lang yung pera natin. We have limited resources. So what do? We prioritize based on the need that we are facing right now. Kung ano yung mas importante, dun muna kami nag-allocate ng budget. So we prioritize and then procured rice and vegetables from our local farmers for relief operations. Yung kahit na yung rice namin dun rin ang galing later, wala na, naubos na namin na purchase yung mga produce nila, then we have NFA, no, na pwedeng bilhan ng mga bigas para binigay namin relief operations to all households in the municipality. Lahat ng households nakatanggap talaga ng bigas. 1 sack of rice, at give them half sack. Second phase is we give them another half sack. So that's 1 sack of rice each household. May pera man o walang pera kasi lahat affected, no? And then launching of donation drive from private individuals and organizations. So there's a lot of NGOs, private individuals who help us and send donations, mga boxes of canned goods, mga eggs, trays of eggs, and other goods and cash para donation natin sa ating mga constituents. Then accessing financial assistance from the national and provincial government was also done. And it's good that the province also helped us a lot. And of course, the national government through the Bayanihan funds. Okay. Another strategy that we have done next slide, please. Okay. The establishment of quarantine facilities. So yung isang challenge kasi, di ba, wala kaming quarantine at first. So what we did is to establish quarantine facilities. Nagpatayo kami through the support of our provincial government, mga financial assistance. So we now have this native kubo and the pine houses na pinagawa namin for the quarantine facility. And prior to that, of course, we have also the resorts in our municipality as our quarantine facilities. Another strategy is the stoppage to address the stoppage of transport during ECQ. So kasi walang masakyan ang lahat, so iba nagtatrabaho and wala nang movement kasi wala nang sasakyan. So what we did is to put up a libreng sakay program wherein the also spent for this the fuel, and we paid the driver, we rented the vehicle. Nakausap namin yung mga drivers, okay, yung biyahe, wala rin kayong kikitain, so babayaran namin kayo, i-transport nyo lang yung mga kailangan magtrabaho dun sa city or may mga important na necessities na dapat gawin dun sa city, binabayaran namin yung driver and the fuel. And then, the same is true with from the barangays to the poblasyon. Barangay natin, we encourage them also to do their counterpart. Nag-shed out din sila ng funds para igastos doon sa tricycle natin. So, nag-counterpart ang municipal at saka yung barangay. Another strategy is to address the disruption of economic activity and loss of income. So we established the community talipapa in Barangay Wari-Wari and then Barangay Kabilawan para mas malapit sa ating mga constituency yung pagbili ng mga basic necessities nila, and then the bicycle and jeepneys for libreng sakay. So yung may schedule lang kaming ginawa kasi tinanggal yung market day in every municipality in the province of Iloilo through the executive order of the governor. So what we did, every day bukas yung merkado, yung market. Pero may schedule lang yung barangay, clustering barangay, yung pumupunta doon. And then we hired tricycles to bring the people from the barangay to the market. So that's what we did. And to ensure na hindi naman nawala ng income yung mga drivers, sila pa rin yung hinar to do the transportation. And of course, yung mga vendors natin, mga small micro entrepreneurs natin, through this talipapa, at least they were given a chance na patuloy pa rin yung pagbibenta nila. Next slide, please. Okay, next slide, please. So for us to address the disruption of economic activity and loss of income, we procured the produce of our farmers. So from lahat ng produce nila, gulay, mga munggo, lahat na pwedeng bilhin at may pamimigay as relief operations, ginawa natin yun sa ating mga farmers. No? And also the accessing of financial assistance from the DSWD, other government agencies, and the municipal also give incentives to our frontliners, yung mga volunteer frontliners natin. At least kasi yung iba na wala ng trabaho, at least somehow meron silang kinita rin or may nakuha rin sila. Then another strategy was to contain the COVID-19 cases in our municipality. So we established border control and quarantine control points, capacitate BHERTS and forge partnerships with organizations like the Naval Reserve Command, and maximize the LGU employees and job hires. So hired additional job orders, yung mga na-displaced na nawala ng trabaho, nawala ng income, at least we were able to give them job here in the municipality. Next slide, please. So this is what we did, no? Yung kanina sinabi ko yung sa ineffective learning modality for children. So we launched this learning through municipal service volunteer program, and we are giving also incentives or honorarium to our volunteers in the amount of 2,000 pesos. They go out to every households identified by the schools. Yung school kasing mag-identify kung sino yung mga bata that needs guidance and assistance in answering their module. So tapos dala yung doon pinupuntahan ng ating volunteer, and then at the end of the month binibigyan namin sila ng 2,000 pesos. This is one way for us to uphold the developmental rights of our children. Next slide, please. For the results that was generated from the management strategies, so of course, we were able to contain somehow the cases and control the sudden surge of local transmission through the effective management of inbound travels, activation and establishment of municipal and barangay quarantine facilities, and we capacitated our BHERTS. So that's one way to control. And another result was effective programs on aid assistance to affected sectors by systematic prioritization. So the use of local resources, material and financial, efficient use of that one was done, no, to ensure na systematic yung pag-prioritize natin ng kung anong dapat gastusan natin. And then gained access to available resources from national and provincial government. So these are the strategies that we do to attain this result. And another result is to regain losses in local economy and contribute to the restoration of our economy. We were able to provide opportunities to local entrepreneurs natin through mga tiangge, yung mga gumawa kami ng tiangge, we organized the merkado lokal para in-encourage lahat ng mga micro-entrepreneurs to sell their products here in the municipality. And we also tap affected sectors to augment the LGU services and compensated them in return. So yun yung sinabi ko kanina, mga drivers natin, mga sectors natin ng mga drivers, mga volunteers natin, ginamit natin sila, and in turn, nagkita naman sila, no? They were able to earn income to that. So we were able to regain the somehow losses in local economy. Next slide, please. Another result that was generated was increased learning proficiency of our children. So far sa ngayon, based on data of sa DepEd, lahat naman nakakapasa ng kanilang module and wala namang naiiwan sa kanila ngayon. Internet is slow. Next slide, please. Wala na siya.
Are you there po ba? Naghang po ang inyong feed po. Mayor Stilia. So, sandali lang po, ma'am. Everyone, antayin lang po natin bumalik po yung internet ni ma'am at nagkaroon po ng technical.
Hello, I'm back.
Ayun. Thank you po, ma'am. Sige po.
That's the problem with that technology, no? Okay, so punta na tayo sa stumbling blocks, no, na na-encounter namin sa pag-manage ng COVID cases namin. So we have mga stumbling blocks kasi yung nag-issue ang IATF, National Task Force natin, na mga measures na parang hindi naman applicable sa aming LGU. Just like nung last August 2020 na inisyo nila, yung mga ROF na in-advise na hindi na undergo sa protocol ng mga LGU. So medyo nagka-problema tayo doon, ano, kasi sabi hindi na mag-undergo sa protocol ng LGU pero pinapasundo pa rin sa LGU. So those are things na kung minsan ito yung issue 1 sa taas, ito yung order sa taas, tapos dito hindi naman applicable sa aming locality. And another stumbling block is the limited resources, of course, nandyan parati yan. But we make of it, and the attitude of the people, especially on the discipline, observance of the minimum standards. So those are the stumbling blocks that we have encountered. And for the success factors, of course, very important yung leadership and political will of the officials to implement these strategies. And also participative and inclusive governance. I really believe that if everybody's involved in the decision making, if you get the people's cooperation, hindi ka talaga mahihirapan, no? And you attain your vision and your goals kung saan tayo papunta because of the participation and the inclusiveness of everybody, of all the sectors in the community. And another success factors, of course, kasi pinrioritize talaga namin first need na kailangan i-address. So efficient use of limited resources is very important, and fostering the culture of oneness through bayanihan spirit. So in times of pandemic, dito rin natin nakikita na yung mga tao is really there to help, sending donations para ma-extend sa ating mga affected na community, no? So those are very important factors to attain success. And of course, we still have the remaining challenges in the pandemic management efforts natin. Number 1 is food security. Number 2 is the economy. Number 3, of course, budget. Number 4, exhausted health personnel and frontliners. This remains to be a challenge para sa mga local government unit. And for the lessons learned, the support to farmers, no? Ito yung isa ko ring nakita na supportaran natin yung mga farmers natin. Yung agriculture program natin, we need to enhance it, to promote it more kasi this will give us food security. In times of pandemic like this, pag wala ng grocery store, wala ng iba na pwedeng bilhan for city kasi kami municipal, we are 25 kilometers medyo malayo-layo pa. So kung may pagkain lang dito sa aming locality, hindi talaga sila magugutom. At saka kung merong lang mga gulay na tinatanim ng mga farmers natin, and we also encourage na yung mga households magtatanim din. So dito na I've learned a lot na wala palang gutom. There will always be food security. Yung farmers at saka yung households, meron na silang mga, so insured tayo ng ating pagkain. So inclusive and participative governance will ensure the massive move to implement COVID-19 management strategies of the locality from the executive to the legislative, from municipal to barangay level, and with the involvement of the private organizations. So yan po yung na-learn natin with this COVID. And our ways forward, we're looking into free municipality. Ito yung ito yung tinitingnan natin ngayon, that we can manage the cases in our municipality, ma-contain natin one lockdown. Because if there's lockdown, mahihirapan talaga ang ekonomiya. And when mahihirapan ang ekonomiya, there will be hunger and poverty. So maraming salamat po, and be safe everyone.
Hey ma'am, marami pong salamat sa inyong presentation po. I'm sure marami po pa kayong share na insights mamaya sa open forum, at sana po makastay po kayo. Marami po nagtatanong nga tungkol sa mga inyong programa dito po sa chat box. Kung gusto niyo po sagutin, pwede po, pero via chat na lang po. Okay? So moving on po. Our next speaker, si Mayor Kirk Vicasis, is the Mayor of Bayugan City, Agusan del Sur. Sir, ayun na po yung floor.
Of the Philippines.
Sir, yan, kaka-unmute niyo lang po.
Okay. Narinig na po ako ngayon.
Yes po, rinig po kayo ngayon.
Pinsagil and the rest, and the NCPAG people, and as well as, of course, we have here the Vice Governor Karen Agapay, the Vice Governor's League President, National President. Pleasant afternoon to everyone. I am here to present our COVID-19 pandemic crisis management here in the city. Our city is a fifth-class component city in the province of Agusan del Sur, with a population of 117,125, with a land area of 68,877. And the source of income here, the people of Bayugan or the Payaganons are engaged in agriculture. For COVID cases, as of May 25, we have 61 active cases, 233 recovered, and we have 11 deaths, and we have 305 confirmed cases. The challenges encountered is the resistance from the public, especially the PUMs and the PUIs, and the availability of the quarantine facilities, the financial resources constraints, and disruption of several businesses and livelihood. The strategies, one good thing here is, before the pandemic, we trained 28 personnel, ICS trained. So we activated our operations, emergency operations center, and with that 28 personnel, trained personnel, yon malaki yung naging tulong sa amin. Next slide, please. We have also the strategies of giving the quarantine passes for essential goods only para sa paglabas nila sa mga bahay. We have the implementation of the curfew from 9 p.m. to 5 a.m. Actually, we do have this ordinance already before the pandemic. We have the tightening of borders. We have 6 checkpoints here 24/7. And one good thing here is palitan yung mga barangay officials namin. We have 43 barangays. So palitan sila, manning the 6, yung 6 na checkpoints all over the city. We established 2 quarantine facilities, MOA with the national offices, with DepEd, and as well as with BJMP. We've constructed a very low-cost TTMF 3 buildings yon pero naging 3 buildings siya actually with the amount of 4,800,000. So each building will cater 12 per packs. Next slide, please. We also distributed rice, 2 tranches po yun, lahat ng households po, so dito sa city. And we also distributed 2,000 pesos per household for the centro or the poblacion area and as well as the Taglatawan, because that's economic strategy po ang ginawa namin because we need to again keep the economy moving, so that is why pera po ang binigay namin sa sentro kasi meron po tayo mga sari-sari stores, we have the groceries, and we have the malalaking stores po dito sa sentro. The deployment of health personnel for the distribution of essential medicines per barangay and multivitamins per household, especially for our senior citizens, lahat po yun house to house ang ginawa namin. So one good thing is we have really good health personnel as of the moment na talagang nagmaman sila. So for all you know, we have as of the moment in our infirmary hospital, we have 9 doctors, and for our city health office, we have 4 doctors. And one good thing also is tinulungan tayo ng Department of Health of their like augmentation of their nurses. Then we installed also the antigen and RT-PCR testing centers. We adjusted our annual budget through supplemental budgets to fund the logistical requirements of COVID-19 crisis management. So I am so happy na hindi masyadong naapektahan itong budget namin because of the budget in-adjust na lang namin based doon sa pangangailangan ng mga tao because we have the regular programs already that is really fitted for itong pandemic na ito. Next slide, please. We have here the strict prohibition of the senior citizens and minors in public places. We organize the barangay-based contact tracers. Nagtap po kami sa mga barangay captains and as well as the DILG contact tracers. We adopted the hospital referral system because we need to have that here para hindi po magkakagulo-gulo. The transport vehicles from the airport, from the seaports, or even from land travels nila from other places, lahat po, they are support. The local government supported lahat ng mga LSIs natin and those who are people who wish to go back and to come back here in our city. The city employees, of course, they do have like skeletal work as of the moment, and they followed, of course, the DOH health protocol, and we introduce regular disinfection for all public places and private establishments. We also utilize the tri-media for general public health protocol information and dissemination. We have 24/7 hotline, and we are doing it lahat po, our surveillance nurses, our surveillance team, lahat po 24/7 until now. The Sanggunian also to resolution, so we declare the state of health emergency here. Right after, we also have the enactment of the ordinance number 128 series of 2020, the general quarantine community quarantine guidelines to prevent the spread of coronavirus. We have also issue executive orders. With the result of the executive orders, the ordinances that we have, the cities in Caraga, Bayugan City has the lowest COVID cases ever recorded. All our doctors and health personnel are organized to respond to every situation. We do regular assessment to improve our services and facilitation. We gain the confidence of different private sectors, and we have the lessons learned that it must be the part of development investment plan of a local government to always secure our people from any crisis. There should be a resource buffer that will be used in any time of the day when an odd situation will come. It's a good thing here in our city that when I assume office, we do have like so much money to fund for this COVID-19 pandemic. we did not realign all of the lahat ng sobra po na pondo ng city government ay lahat po sinopplemental na lang namin doon. Inaugment na lang namin sa mga pondo namin na regular budget for health and for agriculture. The earlier you contain the spread of the virus, the better for our economy, for your economy. So yun yung mga lessons learned po natin dito sa city. Next slide, please. So the stumbling blocks here is of course, as all you know, the 2020 budget was prepared in 2019, and the president placed the entire country into health emergency. No single plan was included, so medyo mahirapan po tayo. We have the logistics to response to COVID-19 was not ready. The disruption of the supply chain and the major agricultural products. The strength of our health workers cannot compensate to demand of work. The scarcity of medical supplies, drugs and medicines and PPEs, and as well as the PTVs or the patients transport vehicles or ambulances. Lahat po yun, nakakaproblema po tayo talaga that time. And until this time naman po. Next slide, please. So our success factors, we attribute to our win through private sectors such as business groups, professionals, sports enthusiasts, retirees and the SK Federation, as well as farmers, women, LGBTQ, Tricycle Drivers Association, and the barangay leaders, and many more. Legislators and their coordination with the respective barangays, and as well as, I think, lahat ng mga health personnel namin, the COVID-19 management organization led by doctors and health professionals who are in the front line for 24/7. Next slide, please. Business, for our way forward, business must be as usual, leaving the imprints and the history of pandemic that government is the core of every decision, putting people's satisfaction, security and well-being as the ultimate indicator of public service. Second is we scaled up with the agriculture sector, socio-economic sector, and the business community with condonation of penalties for business and real property taxes. Thank you very much and a pleasant afternoon to everyone. Maayong hapon ka na po.
Okay, thank you, sir. Salamat po sa inyong presentation. Hopefully po you can stick around sa ating open forum sa dulo po. Okay, next po ang ating third speaker, si Mayor Neriby Santos Martinez from the Municipality of Talavera, Nueva Ecija. Ma'am, please po.
Magandang hapon po sa ating lahat. Ako po ay nagpapasalamat sa UP-NCPAG at sa LPGP sa pagkakataong ito na maging bahagi ng ating webinar series na Rising to the Challenges of the Pandemic. So ito po ang aking presentation for Talavera. We are a first-class municipality. Kami po ay nasa 1st District of Nueva Ecija. Our land area is 14,000 hectares. At mayroon po kaming 53 na barangays. Medyo malaki po ang aming bayan. At we have a more or less 125,000 population as of 2015 census. Our ERA this year is 314 million and a projected local income of 118 million this year. Kamukha po ng ibang bayan, kami po ay talagang apektado rin ng pandemic na ito. The Philippines is clearly not ready to face a pandemic in our present capacity. As of May 23, 2021, mayroon po kaming total number of 555 cases with 412 recoveries and 46 deaths. The number may seem small compared to the cities in Metro Manila, but at this number, mataas po ang aming mortality rate at 8.28%. Our rapid antigen test positivity is at 9.8% based on our MHO data of 1,734 na test at ang nag-positive po ay 162. Hindi po kasama doon yung mga hindi inaamin na sila ay mayroong nararamdaman at yung mga ayaw pa rin magpa-test. Sa amin pong munisipyo ay mayroon kaming isang secondary hospital at 15 kama doon ay naka-allocate for COVID patients. At 10 kama po ngayon ang inaayos para mai-allocate pa rin po sa mga COVID patients. Ang aming mga challenges na na-encounter ay ang mga sumusunod. Siyempre, kakulangan po ng mga testing and testing facilities. Yung kakulangan sa kahandaan ng ating bansa at ng mga LGUs in handling the pandemic at kakulangan sa financial capacity. Gayon din po ang kakulangan sa contingency funds para po sa situation na ito, lalo na sa pagdami ng mga kaso. Kakulangan sa mga trainings para sa mga medical and non-medical frontliners, shortage of health workers and uniformed personnel to make sure all checkpoints are covered, at non-implementation of strict border restrictions in our airports and seaports. At we only have one hospital sa aming probinsya na mayroong mga ventilators for severe COVID-19 cases. Ito po yung mga ginawa namin mga approaches at mga estratehiya para ma-manage yung health crisis na aming kinaharap. To address these challenges, I spearheaded the creation of our centralized ICS, or Incident Command System, which was formed earlier than the creation of the National IATF, followed by the creation of the local IATFs. And after creating the local IATF, I have instructed all barangays to form their respective PHERDs. In managing the pandemic, all at the LGU level, I will discuss it in sectors for health, for education, for livelihood, for agriculture, and for social services. Una po ay sa health. Kami po ay mayroong bakery ng bayan na nagbigay at namahagi ng mga nutribans para ma-address yung pangangailangan ng sustansya ng ating mga kabataan, ng ating mga katandaan, at ng iba pang mga vulnerable sectors. We also have food banks na nanibigay ng mga healthy meals para sa ating mga mamamayan. We also have the supplemental milk feeding program and feeding programs para po sa ating mga kabataan and other vulnerable sectors. We also have veggie packs na ibinabahagi po namin sa mga buntis, sa mga lolo at saka sa mga lola, at saka sa mga iba pang mga nangangailangan ng mga gulay. Itong mga gulay po na ito ay binili po namin sa aming mga local producers dahil kami po ay maraming gulay sa aming bayan. Meron kaming mga Nutri-Wheels ang umiikot sa mga barangays at namamahagi ng mga hot meals para sa ating mga kabataan. We partnered with our SKs para po sa aming mga portable hand washing stations para masiguro na mayroon pong hugasan ng kamay ang lahat ng ating mga barangays. At yung aming isang ospital sa aming bayan, ay binigyan po namin ng disinfection channel para masigurong maayos ang pagpasok at paglabas ng ating mga kliyente doon. At sa ngayon ay ongoing po ang ating vaccination program na sa tulong po ng ating DOH. At ngayon po ay mayroon na rin po kaming free antigen testing booths sa aming mga health centers. For our social services, bahagi po ng aming ayuda ang vegetable relief packs kung saan kamukha po na nasabi ko ay ito po ay mga produce ng aming mga local farmers sapagkat kami po ay vegetable basket of Nueva Ecija, kaya't marami kaming mga oversupply ng vegetables dahil po limitado yung pagtransport ng mga gulay at ibang kalakal sa mga ibang lugar, kaya po nagkaroon kami ng oversupply. Kaya ginawa ko po na binili ko yung mga sobrang supply ng mga gulay at bahagi po iyan ng aming ayuda para sa lahat ng bahay at pamilya ng aming bayan. Gayun din ay mayroon po kaming libreng transportation para sa aming mga kababayan na nangangailangang pumunta sa mga lugar or yung mga essential workers at lalo na po yung ating mga frontliners na pumupunta po sa mga ospital at sa mga clinics. Meron po kaming point-to-point shuttle service para po sa kanila. Yung ating mga displaced sectors, kamukha po ng ating mga tricycle drivers, jeepney drivers, mga barangay frontliners at mga ambulant vendors ay nakatanggap ng cash assistance mula po sa LGU para po pang-recover ng mga nawalang hanap buhay po nila. Sa aming mga lolo at saka sa mga lola ay nagdagdag po kami ng LGU funded social pensions para pangdagdag sa mga pangangailangan po ng ating mga senior citizens. At para po sa pangkabuhayan ay namahagi po tayo ng itik at namigay po tayo ng dagdag na kapital para po sa ating mga maliliit na mga negosyante. Para po sa education ay inalam po natin yung mga pangangailangan ng mga schools at tayo po ay nakapagpulong sa mga principals ng ating mga paaralan. Ito po yung mga nabanggit nila ng mga pangangailangan para masigurong tuloy-tuloy ang pag-aaral ng ating mga bata. Ito po yung mga pamamahagi ng mga equipment sa mga eskwelahan, kamukha po ng machines, Xerox machines at lithographs para po sa mga eskwelahan. Dito po ay nag-align po kami ng budget mula po sa mga infra at napunta po sa mga pangangailangan ng ating mga schools. At sa agrikultura, ang aming bayan po ay mayroong gulayan program. Gulayan sa bakuran, sa paaralan at sa eskwelahan na ngayon po ay nasa ika-8 taon na po ng aming programa. At ito po ay tamang-tama noong pandemya dahil talagang ito'y nakatulong para masigurong mayroon kaming kasapatan sa pagkain tsaka sa nutrisyon ng aming mga kababayan. Kaya mas pinigting po namin yung aming gulayan at namahagi po kami ng mga libreng buto at mga seedlings sa mga bahay. Gayon din po bilang tulong sa aming mga local rice farmers ay nagbigay po kami ng mga libreng binhi para po sa kanila. At para sa karagdagan, we have placed checkpoint sa mga lugar kung saan ito po ang daanan ng mga galing sa mga iba't ibang lugar. We have dialogues and discussions to facilitate intersectoral alignment para po sa to address concerns regarding the pandemic. At kami po ay nag-reallocate ng mga funds at utilized our savings in order to channel the resources in handling the current situation. These funds were initially used to purchase PPEs, disinfectants, and some equipment. Funds were also used to renovate and repair existing buildings para po maging facilities para po sa quarantine. We pushed through with immediate renovation of our evacuation center to be used as our Talavera quarantine facility and requested for DepEd's permission to use elementary schools as quarantine facilities as well. By June 2020, we have a 34-bed capacity for COVID-19 positives that can accommodate the mild, the moderate, and asymptomatic patients. We also signed MOAs with 2 crematoriums to facilitate the process since positive patients who died must be released within 12 hours. Through regular meetings with our local IATF, I have issued executive orders in order to handle the COVID-19 situation depending on the needs of the community and how strict we need to be to manage the situation. Venue capacities, liquor bans, curfews, allowed activities, and alternative work arrangements are some of the items discussed in these EOs. With the help of our police and barangay officials, we are able to impose these orders accordingly. Aside from palengke scheduling, we have mandated the barangays to have their own palengkes to mitigate the rush of people in our population areas. Meron po kaming ibinigay na puhunan para po doon sa mga palengke sa barangay for qualified residents to jumpstart the barangay palengkes. Mayroon po kaming 14 palengke sa barangays sa buong bayan ng Talavera. A one entry, one exit path was implemented to facilitate flow of people coming in and out of the market. Meron din po kaming alternate roads para to provide a more systematic traffic for people and residents of populated areas. At during the ECQ, yung aming mga empleyado ng munisipyo and frontliners ay nakatanggap po ng mga hazard pay from our LGU. Our local DRRMO played a vital role in our fight against COVID-19, as their team is given an additional task of disinfecting facilities, equipment, buildings, and households exposed to the virus. They have also initiated the discipline box in business establishments to encourage distancing in our community. At dahil kami po ay isang munisipyo at mayroon po kaming large farming community, marami po kami pinamigay ng mga subsidies sa aming mga farmers for grains and other crops. On the onset of our lockdown from March to April 2020, nagkaroon po kami ng pamamahagi ng mga travel permits doon sa mga farmers na kailangan mag-transport ng kanilang mga produkto sa mga iba't ibang lugar. Sa kabuuan, mayroon po kami na-i-issue na 505 travel permits sa lahat ng mga farmers po namin na kinakailangang magbiyahe ng kanilang mga gulay at iba pang mga produkto sa ibang bayan. Ang mga results na aming na-generate from this implementation ay for 4 months ay wala po kaming COVID cases. Kami po ay nakaranas ng surge just this year, April 2021. At naniniwala po kami that through our prompt response by holding regular meetings, maintaining intersectoral cooperation, and fast issuance of executive orders, we are able to manage the COVID-19 situation better in our municipality. At through all our efforts, somehow, yung po aming ekonomiya ay balikas po namin. At yung aming target for our income, local income, ay na-meet po namin sa kabila ng problema at pandemya na aming kinaharap. At gayon pa man, marami pa rin po tayo nakikitang stumbling blocks for the smooth implementation and management of the pandemic. At kamakailan, dahil mayroon po tayong nationwide surge of COVID-19 cases, one major challenge is that hospitals are at full capacity with regards to accepting positive patients. Kamukha po sa amin, talagang wala po kaming mahanap na mga ospital para po sa aming mga COVID positive patients, and even in nearby cities or towns ay puno po palagi ang mga ospital, and even in Metro Manila. Kaya po isa yan sa mga dahilan kung bakit medyo mataas yung aming mortality rate at more than 8%. So ito po ay napakalaking challenge at problema para po sa amin na mayroong mataas na bilang ng mga COVID cases. Isa pa ay yung masyadong maproseso na aming nakikita mula sa pagpapatest ng RT-PCR hanggang sa pagpapa-admit ng mga pasyente sa mga ospital. Kailangan pa ng recommendation ng RESU for them to administer RT-PCR test, at kailangan pa ng repeat complaint of our MHO para ma-accept po nila yung aming mga pasyente sa kanilang mga ospital. Kaya napakahirap po, hindi rin reflective na actual situation yung bilang na naipakita ko, kasi hindi po kasama doon yung mga bilang ng mga antigen positive cases sa aming bayan. At isa pa yung kakulangan sa funding. Yan po ay patuloy, kamukha po ng ibang LGUs, ay patuloy na magiging hindrance at stumbling block para ma-manage ng gusto yung COVID sa aming bayan. Bukod po dito ay nais po naming mag-procure ng vaccine ang aming LGU. As a matter of fact, mayroon po kaming nakalaan na pondo para po dito. But kailangan pa namin ng tripartite agreement para po makapag-procure ng vaccines. At medyo mahirap yung proseso para mula po DOH to LGU to the private companies na provide ng mga vaccines. Isa pang problema ay syempre po yung mga tao at yung disiplina na hinihingi po natin mula sa kanila. Dahil karamihan po sa ating mga kababayan ay mayroong hindi naniniwala, yung iba ay complacent, kaya isa po yan sa mga problema natin na mahirap pasnurin yung mga tao. Lalo po sa amin dahil malaki yung populasyon po namin, talagang medyo yung pagmamanage po namin ay mas mahirap kumpara sa mga ibang bayan. At sila po ay laging nakaasa sa mga ayuda na ibinibigay ng ating gobyerno. Kaya kami po ay as much as possible, ang binibigay po namin ay more on livelihood at mga seed capital para po sa kanilang pangkabuhayan to jumpstart yung kanilang livelihood projects. At dahil po sa mga ginawa po namin, I think that through the smooth communication between the departments of the LGU, we're able to facilitate the goals of the management in handling the COVID situation in our municipality. We have no issues in realigning the funds, and we have maintained an unhampered communication, and we have regular meetings that were conducted, and the updates are shared with the public immediately through Facebook posts and live updates. Masasabi ko po ng aming LGU maintained a unified front to combat and manage the COVID-19 situation in our municipality. So the remaining challenges sa aming LGU ay una po yung slow rollout of vaccines. Alam po natin na ito ang isa sa pinakamahalagang pamamaraan para masiguro, para ma-meet po natin yung herd immunity or masigurado hindi na po kakalat at ma-contain na po natin yung virus. As I see it, medyo mabagal po yung pag-roll out ng ating mga vaccines. At sa ngayon ay nasa A1, A2 hanggang A3 pa din yung nasa listing ng mga binabakunahan. Kaya isa po yan sa mga nakikita ko na mga patuloy na hamon na dapat ma-address ng ating, hindi lamang ng mga LGUs, kundi po ng ating national government. Pangalawa po, yung kakulangan pa rin ng mga ospital para po sa pagmamanage ng ating mga COVID patients. Kulang po ng mga gamit, kulang ng mga tao, dahil pagod na rin po yung ating mga frontliners at medical health workers sa pagmamanage ng ating mga pasyente. At pang-apat, yung ating education sector has not yet adapted to the new normal. Kasi po, hanggang sa ngayon ay patuloy pa din yung difficulty ng ating mga estudyante at mga teachers para po dun sa setup na mayroon tayo ngayon. Kaya mahalaga po na makita ng ating gobyerno na yung pangangailangan po na ito ng ating sektor na education. At panglima, yung pong ating mga kababayan ay talagang pagod na rin po sa pandemya. People are becoming reckless by not following the minimum health standards. At yan po ay posibleng mag-contribute sa pagkakaroon na naman ng pagkakahawa-hawa ng virus. At i-combine po ito sa mabagal na rollout ng vaccines, inaasahan po natin na dahil dito baka mayroon na namang lumabas na panibagong surge ng COVID sa ating bansa. At ang mga leksyon na ating nakita ay una, ang napakahalaga po ng preparedness at ng pagkakaroon ng plano para po sa mga bagay na kamukha ng pandemya. So kailangan po na as a nation ay maging handa po tayo sa pag-handle ng pandemic. Wala po tayong contingency plan or safety measures to address the situation. Wala po tayong sapat na mga pasilidad at kulang yung ating mga frontliners at yung ating mga kababayan ay kulang din yung kaalaman, yung training ng ating mga health workers ay kailangan pumapalakas din po natin. In the future, we must be able to learn from our experiences as well as from the best practices ng ibang bansa at ng ibang LGUs so that when similar situations happen again, tayo po ay nakahanda na. Sa ngayon, yung ibang bansa po ay parang halos near normal na po sila. Kaya sana po yung kanilang mga ginagawa ay ma-adapt din ng ating bansa so that we may provide a better public service to our mga kababayan. At leading the way forward, I think that we have to continue to do our best to alleviate the situation by providing better service to our people. Kailangan po natin na paigtingin yung vaccination. We hope that we can be allowed to purchase vaccines easily kasi may pera po kami kahit papaano, pero mahirap po yung proseso ng pagkuha ng mga vaccines para po sa amin. Kailangan po natin ng mas malakas na kapalaganap ng mga tamang impormasyon sa ating mga kababayan hanggang sa barangay levels para po ma-implement yung mga kaukulang measures to curb the spread habang ini-aim po natin yung 70% ng vaccination ng ating target population. At yun po, yung ating new normal, kailangan din po natin ng yung technology. Kailangan po na maihanda yung lahat ng locality for yung connection sa online. Kailangan po natin na magkaroon ng internet ng halos lahat ng ating mga lugar. Dahil yun na po ang talagang magiging new normal po natin na lahat ay magiging digital. At yun po yung pagkakaroon ng sapat na pondo for managing the pandemic. At huwag po natin kalimutan yung na tayo pong lahat ay affected mentally and emotionally. Kaya po yun pong psychosocial element ay napakahalaga at hindi po natin dapat na i-ignore. So we are looking into a safe way to debrief and manage the affected people in our municipality with focus on families who are hit hard and the youth whose education are hampered and plans altered. At nais ko pong reiterate na that this pandemic can be solved at the LGU, can't be solved at the LGU level. At best, we can only manage the situation in our best effort. This is a problem that needs to be tackled as a nation, and only when we are united, only then that we can say we have triumph. Muli po, maraming salamat at stay safe sa ating lahat.
Okay po. That was Mayor Nery V. Martinez. Maraming salamat po, ma'am. Sana po you can stay sa open forum para masagot ang mga katanungan ng ating participants. Okay, at hindi po mahuhuli. Now, may I call on Vice Governor of the Province of Sarangani and the Vice President for Mindanao's League of Vice Governor of the Philippines, Elmer T. De Peralta, for his reaction. Sir?
Hello,
Hello po.
I am clear.
Yes po.
Clear ba ako? Yeah.
Clear po. Clear po.
First of all, I'd like to greet each and everyone, most especially the Dean, Sir Sagid, the President of the League of the Vice Governors of the Philippines, Attorney Agapay, and our colleagues in the LBGP, mayors, and other stakeholders. Again, a pleasant afternoon to each and everyone. With regards to the implementation of the COVID management, I really like to commend and appreciate the local executives, the three local executives, Mayor Asis, Mayor Civil, Mayor Martinez, for rendering very comprehensive and almost a detailed programs, project, and activities in their respective localities. Although, as I have observed, I think and I believe that there's still more PPAs or more activities, programs, and projects that are being implemented, which are not included because of this limited time. But as I've observed also, almost the three local chief executives, their PPAs or their strategies and activities are almost the same. Although there are salient or very important significant activities which one municipality did not have. But most of the activities and the programs and projects are all equally implemented. Like for example, with Mayor Civil in Iloilo, Visayas, as I can see, they have good yung sa education sector nila. They organize the what we call the learning modality of the children, and they utilize volunteer individuals. And I think most of these volunteers are the Sangguniang Kabataan volunteers, no, yung officers from different barangays. Ito yung isa sa nakita ko na isang problema talaga sa DepEd is how to conduct the modular type of learning. And in fact, I believe that they adopted this because there are certain areas that are hard to reach, which are hindi ma-reach ng technology. So talagang kailangan ng follow-up ng every volunteer sa ating mga estudyante. And for Mayor Kirk Assis of Agusan, may mga good practices din siya, no? Like for example, na-organize prior sa COVID, na-organize na yung ICS nila or Incident Command system nila. And most yung nag-construct agad sila ng TTMF, and most especially yung nakita ko doon is yung talagang nag-distribute sila ng 1 sack of rice. I think this is for every household, and at the same time at the city level or in the urban area, they give cash incentives in the amount of 2,000 pesos. So I think this depends on the sources, income of the municipality. Pag mataas yung resources, yung tinatawag na internal revenue allotment or yung internal income, then I think more incentives can be given to every individuals. And from time to time, they approve a supplemental budget, no, yung sa Agusan. And at yung nakita ko din dito is yung hindi nila inuubos din yung pera nila. They have the buffer resources na in times na worst comes to worst, they still have some funds to be used in cases of sabi ko nga na mag-continue yung pandemic. And I think most important din as I observation is all the stakeholders, the non-government organization, private sectors, private organization, cooperatives are well organized, no, doon sa Agusan. And ito yung naging maganda na nakikita natin. And of course, health workers are also well organized and well trained. Now, with regards to the last speaker, Mayor Martinez, I think she had a very good management also in terms of knowing or prioritizing really what are the really needs of the people in times of a pandemic. Number one, yung nakita niya ito kasi pag pandemic, the health food is really very important. In this case, no, kaya nga marami siyang program. Sa feeding program niya, nag-distribute ng Nutriban food packs, mayroon pa silang vegetable packs, nutrition wheels, and and sanitation. This is very important because these are really the needs of the people in cases of pandemic. And then, of course, the in social program, they produce or they give a social pension to senior citizens and livelihood. And I think most of these local executives, they also give livelihood to their constituents. And very happy to note also that in their place, the place of Mayor Martinez, for 4 months, they have no cases of COVID. And that's very amazing, no? Na kita pa natin, Luzon, National Capital Region, marami dyan. So, very amazing na hindi sila nagkaroon ng cases ng COVID. But in summary, my reaction really is, number one, the COVID response management will always depend on the geography of an area. Geography in terms of number of population, the classification of the municipality, the budget resources of the municipality, and of course hospital facilities. This is very important. Now, why I say geography? Because in our case, in the province of Sarangani, our population is almost 600,000, and we have 7 municipalities. And most of the 7 municipalities are along the coastal area and in mountainous area. What is glaring in this province is we have almost 15 to 20% indigenous people. So they are staying most are in the mountainous area. And in our observation, most of these indigenous people na nandoon sa far-flung areas are not really affected with COVID. Wala kaming nakitang cases na identify doon sa mga area na yon, because one thing is kung may mga OFW or coming from the city or the urban area, namomonitor kaagad namin. That is why hindi kami masyadong nagkakaroon ng COVID cases doon sa mga far-flung areas. Kasi seldom din na bumababa yung mga IPs doon sa rural or urban area. So that's one thing, yung tignan natin yung geography of or the location of the municipality or the province. Second is very important also is the budget resources ng municipality. Of course, pag mababa ang internal revenue allotment or yung internal resources, there's really a very big problem in purchasing logistics, installing facilities, lahat na, no, yung support natin sa community. But it will always depend also on the support of the at the provincial level, no, yung probinsya ang importante doon yung support doon sa LGUs, like here in the province of Sarangani, almost we allocated 8 million pesos per municipality, which were directly downloaded. The money were directly downloaded to the local government units. So dinownload namin ito para mas mabilis yung pag-implement ng programs. Kasi kung province pa ang mag-repack ng mga bigas, gulay, lahat, it will take time. So ang ginawa namin dito with our governor, we downloaded the 8 million pesos in a staggered basis doon sa mga LGUs. And then sila na yung bumili kung ano talaga din yung priority needs nila in lieu doon sa budget resources nila at yung sa resources ng barangay. But nevertheless, hindi lang yun yung downloaded namin na dinownload namin yung cash, but also we purchase PPEs, we purchase antigen testing, swab testing, mga ganon. And ito yung kinulong namin doon sa mga local government units. So that's second thing, no, yung yung budget is very important. Third, very important is the stakeholders' commitment and dedication. No, all the stakeholders in the local government is very important in the support of this pandemic. No? Of course, the human resources is also important. Ating mga health workers, our BHERTs, of giving them incentives. And yung dito sa amin, in the province of Sarangani, we have 5 district hospitals. 3 district hospitals are categorized as first level hospital, and we have 1 provincial hospitals. And of these 6 hospitals, we have 2 district hospitals and 1 provincial hospitals who caters COVID cases. And the most important thing here is yung na-mention ni Mayor Martinez, which I think nakakalimutan ng lahat, is yung psychological intervention of those cases who are caught with COVID-19. And I think I am a physician, and I can really observe and note that halos in this time of pandemic, dumadami ang nagkakaroon ng mental illness. And dati kasi nakikita natin, yung sa data natin is yung mga 40, 50, 60 or 30s nagkakaroon ng mental illness. But now, even the young generation nagkakaroon na ng mental problems, no, psychological problems. Ako nga na may nakita ko, 8 years old nga nagkaroon na ng mental illness, no, hindi makatulog, depressed and anxious sa ganun, no. So I think ito yung isang tutukan natin as the COVID pandemic is still here in our country. And ito lang po yung ma-share ko as a reactor, and I believe that during the open forum, we can still accommodate some questions and concerns of everyone. Maraming salamat po.
Okay, sir. Maraming salamat po. Sana nga po makastay po kayo kasi meron mga specific rin na questions para sa inyo, Vice Governor.
Yes.
Okay. And with that po, tuloy na po tayo sa ating open forum section. Thank you, everyone, sa mga speakers natin po for giving their wonderful insights. Bago po tayo magsimula, magpapaalala po ako tungkol sa mga reminders. Okay? So questions submitted earlier via registration form will be prioritized. Tapos, kung meron po kayong karagdagan na insights at katanungan, remind ko lang po ulit na ibigay niyo po ang inyong pangalan, institutional affiliation, at question via chat box po. Kung gusto po sagutin ng mga speakers natin habang nagsasalita po ang ibang speakers, pwede naman po kayo sumagot via chat. Okay? Ay, sige po, sandali Sir Fred, meron po tayong file na nandun na po yung questions. Or, sige, pwede naman ako na lang yung mag-share para sandali po i-bring up ko lang po yung mga questions na nakahanda na for this afternoon. So, sandali lang po. Slideshow from current slide. So, kita po ba ang aking screen? Para lang sure. So, okay. So, kita po ba ang aking screen? Bago po tayo magpatuloy. Pwede po ako makihina. Kita po. Okay. So, tanong po ni Ma'am Maria Isabel Granada, Director from Lucena City, Quezon, how did you encourage collaboration from the private sectors? Natanong po kanina din sa chat kay Mayor Sibilie tungkol sa kanilang program on tricycles, tapos yung LGU po nagpapambayad for mga fares. Pwede po bang makabigbigay kayo lahat ng insight kung paano po kayo nakikayat at nakipag-collaborate sa mga private citizens sa private institutions? So mauna, Ma'am Sibilie, since Natanong na po kayo sa chat regarding this. Pwede po ba kayo mauna?
Okay. Hello?
Hello po.
Oo. Yung collaboration, yung encouragement ng collaboration from private sectors. Meron kaming ginawang we message, no? We put a message sa social media, sa Facebook account, encouraging private sectors.
Apo. Ay, ano po.
To say na mismo for first they trust the administration para hindi tayo mahihirapan to encourage them for their support to collaborate with them kasi very important yung you have the trust in your in the leaders in your locality. So yun yung una kong nakikita. Kaya parang hindi naging mahirap and parang nakikita rin kasi nila sa amin that we went down to their level to reach out to them and really understood ano yung sitwasyon dun sa baba. Dun sa ano ba talagang kailangan ng mga different sectors natin. Like the driver sector. Syempre, nung nag-ECQ, wala nang biyahe, tinanggal lahat. So ano ba yung mangyayari? Wala na silang kita daily. So what we did naman is to address also the need of those workers and those persons who need to buy mga essential needs nila. So kaya yung ginawa namin is yung mga transport sectors na affected, sila na yung tinap namin. Okay, i-hire namin kayo. Kayo yung magdadala ng mga workers doon sa city. Yung mga kailangan may bibilin doon, kayo yung magdadala. Kaming magbabayad sa inyo. Yung LGU nagbayad sa kanila. So in that way, yung nakita namin yung need doon, tapos we responded to them. Hindi lang yung isang need yung na respondehan namin, kundi pati yung need pa ng mga workers and yung mga kailangan na umalis talaga, magbili ng mga essential needs nila. So, with that, nakikita natin kasi yung iba talaga yung nandun ka sa situation. So, mas madali mong i-address yung need at saka makikita mo talaga yung kanilang pangangailangan. Kung sa vendors naman sa market, so of course, kung limited kasi kinlaster namin yung mga barangays na makakapunta dun sa loob ng market nung nag-ECQ tayo. So hindi sila kumikita ng usual nilang kinikita. So that's why we supported them sa mga na kinreate namin after para yung iba na income nila, at least supported pa rin yung business sectors natin. And of course, yung farmers natin sectors, ito naman, yung iba nagre-reklamo, they cannot bring their produce to other municipalities kung saan nila usually dinadala din yun kasi nga lockdown, yung wala nang transport. So what we did is we gather all their produce, we buy it, and we give it as relief goods to all our constituency. So yun yung nakita natin, kung paano tayo naging madali yung pag-collaborate sa kanila. We identified the need, we responded to it.
Tapos bumaba po kayo talaga in order to meet their needs.
Yes.
Mayor Kirk, meron po ba kayong masasabi or may idadagdag? Or from your experiences naman po, meron po ba na iba? Ay sir, nakamute na naman po kayo. Ito po. Ayun.
Thank you. For our city, maganda yung collaboration namin dito sa private sectors because most of the time, even walang pandemic, parang yung spirit ng bayanihan. So we are here, nandito kami para magtulungan. And during the time na parang nahirap na yung, for example, yung transport. So what we did, at kasama yung mga private sectors, during that time, sila na mismo nag-volunteer na para umikot, magbigay ng mga ayuda. And nothing in return naman. So yun ang pinakamagandang collaboration namin dito. But we gave them, of course, kung ano yung po pwede namin i-extend from the local government.
Okay. Ma'am, Mayor Santos, meron po ba kayong maidadagdag?
Sa Talavera po, we have an ordinance para sa aming food bank. So during the pandemic, gumawa po ako ng sulat sa mga negosyante po namin para sa food bank so they can donate their goods or yung pong nakalagay sa aming ordinansya ay yung mga produkto nila or mga goods nila na po pwede mag-expire ay dapat po ibigay din po nila sa amin para maipamahagi po namin sa mga tao.
Oh,
So
okay.
yun po yung ginawa namin doon. Meron kaming ordinance for a food bank at doon po nila binibigay lahat ng mga goods nila na pwede ipa-consume sa public.
So talagang coordination po talaga para malaman nyo at ma-disseminate. Okay. Sir, Vice Governor Peralta po, meron po ba kayo may idadagdag from experiences sa Sarangani?
Yeah, actually the same with Mayor Mark Asis, yung spirit of bayanihan, yun yung isa talaga na yung commitment and dedication ng private sectors. Dito kasi sa province of Sarangani, mayroon kaming mga dito canning factory, mga yung sa mga banana factory sa ganon. So sila yung tumutulong, nagbibigay sila ng mga canned goods, yung mga tuna flakes dito. So yun yung nakakatulong sa food security namin dito.
Sige po. Sa susunod po na tanong, ito naman ay related sa mga hindi nakakakuha ng relief. So, how should LGU leaders address citizens who have felt that the COVID response in their areas have been lacking? So, pinagsama po namin nito sa mga maraming questions ng mga participants. Parang, paano po mas maipaparamdam ng local leaders kung feeling ng mga mamamayan ay kulang pa ang nakukuha nila mula sa gobyerno? Sino po gusto mauna? Ay, sir. Sige po. Ay, unmute po kayo, sandali. Tapos si Ma'am Mayor Sevilla po yung susunod. Okay, sir?
Okay. For our city, actually, ang lagi namin, bayuganon walang dapat maiwan. So, walang iwanan. So, what we did during the time na nag-start kami, alam naman natin na walang puro kulang yata lahat yung expectation ng mga so expected na lahat ibibigay. But what we did with our 26,580 households all over the city, lahat ng LGU at saka lahat ng mga line agencies na nakaano dito sa amin, lahat ng national government agencies na nandito sa amin sa city, what we did nung panahon ng pandemic sa pagbibigay namin ng COVID response at saka yung pag-address sa lahat ng bagay ay talagang pinadama namin through house to house po. So yun ang ginawa namin. Even like yung pinaka-far flung ng mga areas namin, yun ang ginawa namin. So bawat isa, so we organized community parang community persons na sila yung mga point persons na nandoon mismo sa community. So lahat ng mga leaders nandoon at lahat ng mga point persons alam nila kung ano ang gagawin. So they are meron kaming magandang response na plan for this COVID. So talagang hindi po pwede na hindi naramdaman ng mga tao. So kaya smooth po lahat ng implementation namin ng lahat ng COVID response namin dito sa city.
Okay,
Pabigay ng ayuda, lahat, even sa pagbibigay. And I would like also to inform na sa lahat ng mga nandito na ang city po namin kasama po yung ay awardee po kami ng National ng Department of Social Welfare and Development for good implementation of the programs ng social services.
Okay. Mayor Sevilla po, kayo po yung susunod na gusto mag-respond. Yeah.
Yes. How should we address the citizens who felt that the response is lacking? So kung alam naman namin, let's say, namigay kami ng ayuda dun sa mga households namin, and alam namin na kukulangin, so we tap the barangays to augment the resources of the municipality. Just like what we did with the half sack of rice na binigay namin on the first phase. Nagbumili yung LGU municipal tapos pina-augment namin sa barangay kasi alam namin kukulangin. Kasi yung isa naman, hindi mo mabigyan, magrereklamo for sure. So we made sure na lahat mabigyan kasi lahat naman affected ng pandemic. So, and then another thing is we disseminate through social media kung anong meron at kung kung ano lang yung available. And through the barangay captains also, yung information dissemination within the community na kailangan maintindihan nila kung bakit kulang, bakit ganito lang. So, very important yung information dissemination.
So, pag-manage na rin po ng expectations as much as also giving resources. Okay. Vice Governor De Peralta, meron po tayong gusto sabihin.
Yes, as I have said earlier, yung province namin is sinusigurado namin na lahat ng LGUs ay mabigyan ng allocation ng funds. Hindi siya fairly allocated but equally allocated. So meaning mayaman ka man o low class ka, the same amount of funds are being downloaded to the LGUs. So yun yung cash support namin doon sa mga LGUs. But at the same time, hindi lang limited doon yung binibigay namin, dinodonate namin. But at the same time, we also support by giving complete PPEs, disinfection, logistics, and yung funds for the purchase of swab antigen. And in fact, yung mga nurses namin sa hospitals, they are receiving 100 doon sa mga COVID facilities namin yung sa 2 district hospitals saka yung sa provincial hospitals namin. Yung mga nurses namin doon ay tumatanggap sila ng almost 100,000 plus salary per month, and yung mga doctors namin doon ay tumatanggap sila ng salary na 200,000 per month. That is to ensure that yung mga health workers natin, yung nurses, medical workers natin, hindi aalis doon sa mga hospitals natin.
Okay. Thank you, sir. And ma'am, Mayor Neridi, meron po ba kayong gustong idagdag? Or, ayun.
Hello.
Yes po, rinig po kayo.
Sa amin po sa Talavera, sa kabila ng nabigyan po namin lahat ng bahay ng ayuda, ng bigas, delata, manok, twice, ay mayroon pa rin po ng mga talagang mga kababayan natin na nagreklamo. Kaya we made sure na those who are heavily hit receive talagang yung mga kinakailangang support. Kamukha nga po ng mga nasa transport sectors, yung mga nawala ng hanap buhay, yung mga TODA, yung mga HODA, at saka yung mga ambulance vendors na hindi po nakalabas, hindi po nakapagtrabaho, ay nabigyan po namin ng special na support. At yung mga hindi naman po naghahanap, na hindi naman po talaga nangangailangan, na hindi po yan nawawala sa kahit saan mga LGU, ay pinapaliwanagan po namin sila ng maayos. At ipinapaintindi po sa kanila na may mga kailangan tayong unahin na mga sektor na mga kababayan po namin. So that's how we did it in Talavera.
Okay po. Thank you po sa inyong lahat. Next question po. What will happen to individuals who will not avail of the COVID-19 vaccine? May consequences po ba para sa mga tao na to, either legally or at least at the may misdemeanor po ba? This is from Rolly Huntilla, Kagawad of Charito, Bayugan City. Pero po ba kayo naiisip na sa mga taong natatakot kunin yung vaccine? Or kunyari po, hindi naintindihan kung ano po ba yung benepisyo ng COVID-19? Meron po bang mangyayari sa kanila? If anyone would like to answer, huwag na po mahiya. Ay, Sir Kirk. Sige po. Ayan. Naka-unmute na po kayo.
The question is from my city actually, so I need to answer the question.
Sige po.
Actually, hindi naman the national government is just encouraging us to be vaccinated para marating natin ang herd immunity natin. And kung sa consequences naman, parang wala naman yata tayong batas na pwedeng para magbigyan ng parang penalize or whatsoever itong natin kung hindi na po pag-vaccine. So the role of the local government units all over the country right now is to see to it that yung roll out ng vaccination ay supported ng mga LGUs.
Apo.
Pero sa mga tao po na ayaw, because maybe some of them doon sa mga religious beliefs, ayaw nila kasi we incarnated that here sa city. Alam naman natin na hindi tayo lahat ay po pwede na mag-vaccine or maybe bawal talaga kasi ayaw din nilang mga doktor ng iba. So I do hope that may mga ano kasi may sakit na parang they are thinking na hindi pa masyado convinced sila na magkaroon ng vaccine. So I do hope that the LGUs all over the country will just like ask the people sa lahat ng mga bayan, sa lahat ng mga cities na ma-encourage sila na magka-avail ng vaccines. So, yun lang for our city.
Okay, thank you, sir.
Yes,
Yes po, Apo.
Gerald.
Ano po, sir? Apo.
Yeah, actually, yung vaccine ng COVID kasi, kung titignan natin, way back, ang Department of Health talaga mayroong vaccination program. Yung sa mga bata, yung tinatawag na natin na fully, pag nabakunahan ka, na kumpleto mo yung vaccines, yung DPT, measles, lahat, yun ang tinatawag na fully immunized children o FIC. But the problem is, libre na nga yung mga vaccines, but still, there are individuals, parents, na ayaw nila talagang pabakunahan yung kanilang mga bata. So, I think the most important thing here is, tama yung sabi ni Mayor Asis, is talagang ipaalam talaga the importance of the vaccine. So, kailangan talaga natin dito is, now, is yung IEC, yung Information Education Campaign with regards to the advantage of having a COVID vaccine. Kasi sa tingin naman natin na hindi naman kailangan sa scientific studies, hindi naman din kailangan na 100% talaga ng community is mabakunahan. I think 70 to 80% of individuals na nabakunahan, they can already develop the herd immunity. So yun, hindi na rin kakalat yun pag nagkakaroon ng herd immunity.
Okay, thank you, sir. Meron po bang karagdagan ang ating mga mayora na gustong mukhang agree naman po sila. Okay, so next po. How can the Sangguniang Panliliwigan extend support in terms of implementable legislative measures? This is from Jane Flores, Board Secretary of San Fernando, La Union. So, paano po yata makakagawa ng support to implement legislative measures na magagawa po ng mga LGU, lalo na po yung mga LGU na may limited capacities or may ibang pangangailangan na kailangang i-prioritize pero kulang po yung resources. Ano po sa tingin ninyo ang pwedeng magawa ng mga LGUs? If anyone would like to start. As Vice. Thank you po.
Yes, in case ng Sarangani Province, Sangguniang Panlalawigan, ang importante kasi dito, magkasundo muna ang local chief executive saka yung legislative body. Kasi pag magkasundo yan, hindi nagiging problema yung support ng legislative body and local chief executive. Kasi anytime, pag may kailangan talaga, sinicertified urgent, ang legislative body is prepared talaga to conduct a session for certified urgent measures. So ito yung importante doon sa akin lang para hindi magkakaroon ng problema, dapat magkaroon ng harmony yung executive saka yung legislative body ng isang area.
Okay po. Oo nga, kasi mahirap naman magka-clash sila, di ba?
Yes.
Okay po. May iba po bang gustong sagutin itong tanong? Going once. Twice. Sige po. Okay. Vice, para po sa inyo specifically. What are the proactive policies set in place to protect the province from the new strain of the virus that has reached Gensan? This is from John Dave Yanto, an instructor from the University of Southern Mindanao, Cotabato. Ano po yung mga policies na naisip niyo para po sa bagong
very good. Yeah, Gerald, very good question. Yan, no? I think this is not only the problem in our province, but in the entire area, no, nationwide, yung bagong strain. But in our case, we have this policy, yung tinatawag natin na risk-based targeted testing, or what we call the expanded testing. This is done usually among the high-risk areas or high-risk population na na-identify namin, like doon sa mga drivers of the LGUs, offices with more clients, employees na residents with the high-risk area, like in Jensen, na umuwi ng LGUs sa mga canteens, etc., kung saan yung may mga area, ina-antigen test natin sila lahat, 100%. So, meaning, nakikita kaagad natin yung kung sino yung positive. But in fact, doon sa confirmatory results namin na ginawa yung sa antigen testing sa mga high-risk area, 85% yung tinesting namin are all positive with antigen. These are cases who are asymptomatic, who are carrier or spreader. So mas maganda yung good practices namin na na-identify kaagad namin kung sino yung antigen positive. Saka natin pinapa RT-PCR. Yun yung importante. But the problem only is kung nagkaroon tayo ng maraming antigen positive cases, is yung facilities na naman. So ito yung tinutukan natin.
Okay. So parang balancing act po talaga no? Mas marami nakukuha.
Yeah. Yun yung tinatawag na risk targeting system namin.
Okay po. Similar po ba yung experiences sa other municipalities po? Kunyari po, Mayor Nerivi, parehas po ba meron na po ba kayong proactive policies in order to address the strain? Since na-mention nyo nga po, kailangan din na parang national effort ito rather than just a local effort.
Yes, kasi sa amin, sabi ko nga po, kailangan, bago may refer namin sa hospital, kailangan sa government hospital, kailangan pa ng maraming proseso bago ma-accept yung pasyente to get tested. So talaga makakatulong po yung legislation para po dyan. Siguro talaga it's a national move dapat para magkaroon ng uniform policy sa lahat ng mga LGUs.
Thank you po, ma'am. Mayroon po bang idadagdag yung ibang ating mga speakers? Yung Mayor, ma'am. Mayor Sevilla.
Yes, yung tungkol sa bagong mga new variant, how to protect, I think it's the DOH. Sa case namin, DOH Regional Office 6, who should be more vigilant sa pagbantay na to make sure na walang bagong variant na papasok dito. In the case of Region 6 lang. Sila naman yung nakakaalam upon the RT-PCR test result kung ano yung cycle threshold na doon. Kasi alam ko, meron yung binabantayan doon yung pag mababa ang cycle threshold ata. So doon nila malalaman kung ibang variant yung pumasok. So kasi sa case ngayon ng Western Visayas, Region 6, wala pang new variant. Pero yung kami lahat dito sa province, nagde-depend kami sa Department of Health Regional Office 6 for them to watch on this. Kasi sila ang mas makasasabi sa kanila at manggagaling kung may new variant na pumasok.
Okay.
And we all know yung vaccine I think is hindi na siya magiging effective siguro. Correct me if I'm wrong, no, sa mga nandiyan dyan. Baka hindi na siya as effective as kung saan siya na variant.
Apo.
Pasok na bagong variant.
Okay. So malamang nga kailangan po nga natin ng mas maraming coordination with the national government, lalo na po with the DOH at yung IATF, para nga po mas better matulungan rin yung LGU. Mayor Kirk, meron po ba kayong idadagdag or? Sige po, I shall move on to the next question. Hindi tiyak kung hanggang kailan natin harapin ang epekto ng pandemya. Sa paanong paraan ninyo matutugan ang mga pangailangan ng inyong nasasakupan? Ano-ano po ang nabalangkas ninyong pangmatagalang solusyon ukol dito. This is from Ria Mendoza, Budget Assistant of Iginto, Bulacan. So, sa pangmatagalan po na solusyon, meron po ba kayo naiisip? Lalo na at hindi klaro kung kailan matatapos ang pandemya na ito. Mayor Civilian, bukas po kayo naman. Sige po. Okay na po ba?
Yes,
Yes,
no?
po.
Siguro for long-term solution, of course, we still have policies that we have, kung ano yung nandiyan yun na in place na. And then, kasi may titingnan natin, no? Parang wait and see kasi tayo ngayon. After the massive vaccination, we would know kung anong mangyayari, kung talaga bang meron immunity, makokontrol na talaga ito. So that would really depend on the development of the cases. So for now, we just do what we are doing and enforce the policies that we have in preparation sa future. Pero this would really depend on the development of the COVID cases. Depende doon din sa magiging outcome ng vaccination natin.
Oo nga, para mahirap magsabi ngayon, lalo na kalagitnaan, may bagong strains, tapos kung ano-ano nangyayari. Vice, meron po kayong gusto sabihin?
Yes.
Aba.
Yeah. In our case, the province of Sarangani, our goal is really to capacitate all the health facilities, train our health workers, and to procure logistic paraphernalias, no? PPEs, disinfection lahat. When I say capacitate facilities, kung pwede is to construct bigger facilities to accommodate more COVID cases. Kasi kung yung mga district hospitals kasi na dati is hindi siya prepared for the surge of COVID cases. So isa yung sa sustainable is to construct COVID facilities and with complete equipment and instrument, yung mga ventilators, disinfection, lahat niya. Second is to capacitate our health workers, our frontliners. Ito yung pinaka-importante. And then third is to really purchase logistics para hindi ko kulangin in terms of COVID surge. And the most important thing here is yung vaccination rollout talaga. From the national.
Kailangan ko rin po talaga natin mag-invest sa health infrastructure natin, lalo na napakita ng itong pandemya na parang kulang talaga yung ano. Okay. Mayor Nervi po, naalala ko po yung sinabi niyo dahil sa response ni Vice Governor. Sige po. Mayor Kirk, si Mayor Martinez po pagkatapos.
Ako na po ba? Sorry.
Sige. Nakikita ko lang po kasi.
Martinez.
Sige ba, sige. Ma'am,
Martinez first.
Apo. Siya na po,
Ako po, I agree with Vice Gov. Elmer.
Apo.
Una-una yung vaccination kasi ngayon parang medyo mabagal at saka kulang pa yung supplies natin ng vaccines. Talagang dapat ma-encourage natin yung mga private sectors at yung LGUs na mag-contribute para mag-procure ng mga karagdagang vaccines para mas bumilis yung pag-roll out ng ating vaccination program. Pangalawa, yung magbigay tayo ng incentives dun sa mga health workers natin. Kasi karamihan ngayon, nagre-resign or umaalis sa mga ospital kasi nga risk hindi worth din sa tinatanggap nila ng mga sweldo or remuneration. Kaya dapat talagang mabigyan sila ng karampatang incentives o compensation. Plus yung ating mga hospital, dapat talagang dagdagan yung kahandaan. Unang-una, marami tayong kulang na mga gamit at mga iba pang facilities. So dapat kahit na medyo papababa na yung kaso ng kaso, dapat patuloy pa tayo magpagawa ng mga karagdagang pasilidad. At pang-apat, yung kailangan siguro palakas ng technology, yung internet sa buong Pilipinas. Kasi talagang yun na yung new normal na dahil uncertain yung ating future, talagang yung ating mga transactions, karamihan ay through online na. Kaya yun yung mga nakikita ko na pwede nating medyo long term na pamamaraan.
Okay. Not least po, si Mayor Kirk. Okay.
Yes, ito po ay problema ng medical. So kailangan po natin talaga na ipaganda yung rollout natin ng vaccination natin. Sinabi na nga ni Mayor kanina, so kailangan natin talaga na magsuportahan ang vaccination program. So sa lahat mo ng mga cities, municipalities at lahat ng probinsya, meron po tayong vaccination plan po na in-approve naman ng sanggunian. Meron po tayo dito sa city, ginawa po din namin yan. At para paano mahikayat ang mga tao na magpa-vaccine. Ang pinaka din na kailangan nating pagtuunan ng pansin ay kailan tayo recovery natin sa ating ekonomiya. Kailangan nating bigyan ng pansin yan for our city. In our case, we are lahat agrikultura yung sa amin. So kailangan namin, meron kaming dito sa city, yung parang recovery plan kung paano namin mapabilis na mawala yung epekto ng pandemyang ito doon sa aming mga farmers. So I believe that kailangan natin gawin yan sa lahat ng siguro mga LGUs all over the country na kailangan natin na pagtuunan ng pansin kung ano yung maapektado ng mga sektor sa mga bayan-bayan, sa mga cities at sa mga probinsya. At ang technology, yung sinabi din ni Mayor kanina, kasi sa panahon ngayon, lahat tayo nag-communicate kahit na nasa quarantine or isolation facility, dapat connected pa din sila para maibsan yung lungkot nila nandoon sa loob. So I think technology is isa talaga sa factor ngayon na dapat natin pagtuunan ng pansin.
Okay, thank you po, Mayor Asis. Last question na po, which comes from our chat box. Kunin ko lang po yung question. Dali ha. Okay po, wala. Chat, yun. Tinatanong po specifically po, how did you deal with those expenses? So, balik po uli kay Mayor Sibilia, of paying deliverers, renting their vehicles, and buying the producer farmers. So, si Mayor, Mayor Martinez. Did you conduct public bidding for these services or expenses, or did you not encounter problems with COA? Baka gusto po nilang i-emulate yung programs pero hindi po nila alam kung magiging problema po ba ito sa kanilang localities. Could you share your insights po regarding this?
Yes, yung tools sa pag-hire namin sa mga tricycle drivers, mga jeepney drivers, we did that. Wala naman kaming problema with COA, no? And then we did that through payroll system namin. May contract of service kami, tapos naka-payroll. Yun na yung parang
Okay.
So wala naman kaming problema with COA.
Okay, thank you po. At huli na po, Mayor Nervi, kamusta po yung pagbibili ng gulay? Wala rin naman pong similar issue? Just in case.
Wala naman. Kasi we are under parang national emergency. So hindi naman required ng COA na mag-bid. Kailangan talagang yung lahat ng items ay nakalista. So medyo mabusisi lang. Pero wala namang naging hassle. Talaga lang kailangan na tapos yung mga pangalan ng mga pinagbilhan ng mga gulay at ng iba pang goods, kailangan nakalista. At yung mga recipients ay dapat nare-receive nila yung mga tinanggap nila mga goods.
Okay. Mayor Asis, pero puro kayo itadagdag. Wait. Ayan. Okay.
Dito na, for the transpo, wala kami yan dito kasi meron kami volunteer po sila. Pero dun sa pagbibili ng natin mga gulay sa mga farmers, meron kasi kaming farmers association dito na supported ng LGU. So lahat sila ng mga farmers group natin supported. So accredited sila ng LGU. So meron silang mga resibo actually. So pwede silang dumaan sa regular process ng 9184, pwede din sila na yung procurement na ibang mode naman po. So we are just following kung ano yung nasa COA naman po na sa 9184.
Okay. And with that po, ayun na po yung ating open forum. Sorry po to cut it short due to time. Marami po kayong pinadalang interesting na tanong pero ayun nga po dahil limited yung time, hindi po namin matatanong lahat. Thank you. Ay, sir, sige po. Para huling huling sabi. Kung gusto niyo sumali, Vice Governor Peralta.
Okay lang, wala nang problema.
Okay lang. Sige po. Okay, with that po, that concludes our open forum. To give the closing po, may I give the floor to our floor manager, si Miss Selenia Hamid. Ma'am, take it away po.
Hello.
Yun, kita po.
Okay. Magandang hapon po sa inyong lahat. Una po, sa pangalan po ng CLRG and SIPAG, magpapasalamat po ako sa LBGP, ang aming partner dito po sa pag-conduct ng webinar series na ito about rising against the challenge of the pandemic. Kung napansin po ninyo doon sa atin pong, nung nag-register po kayo sa, yung nakapost po sa CLRG FB, ay nakalagay po doon na last na itong webinar na ito. Pero yun naman po ay hindi pa po ito ang huling webinar na gagawin po ng partnership ng LVGP at saka ng CLRG. Bali po ay huli lamang ito dito sa webinar series na ito. Bali mag-iiba lamang po ng focus ang atin pong webinar. From rising from the challenge of the pandemic ay pupunta na po sa ano po ang mga preparasyon na ginagawa po ng mga LGUs patungo po sa pag-revive o pag-re-energize ng ating mga local economy. Kasi yun po naman talaga ang gustong tunguhin ng ating mga LGUs, di po ba? Isa pa po ay naisip po namin sa CLRG na maganda po na kasi po naka-anim na editions na nga itong webinar series na ito. Kaya nagkaroon na po ng 26 LGUs na na-cover. Karamihan po dyan ay ang mga LCs ay alumni po sa mga training programs ng CLRG, kagaya nga po ni Mayor D. Santos Martinez, si Mayor Sibille, at yung iba pa rin pong nag-present na doon sa mga naunang 5 webinars dito po sa ilalim ng webinar series na ito. Pinili po namin sila sapagkat gusto po namin sa CLRG na magpatuloy po ang ugnayan ng CLRG at saka ng mga alumni po ng training programs ng CLRG. At sinika po ng aming center din na as much as possible po pagka nagpili po kami ng LGUs ay lagi pong represented ang 3 main island groups, Luzon, Visayas, Mindanao, at pati po yung gender equality hanggat maaari po ay magkapareho ang bilang ng mga lalaki, ng mga babae na speakers o yun pong mai-involve sa isa pong webinar. Kaya yun pong 26 LGUs na nag-present na po, ay maganda naman po ang kombinasyon. Pagkatapos po, tiningnan din po namin at hanggat maaari din po, tiniyak namin na lahat po ng mga regions ay represented sa mga webinars natin. At sa amin pong record, ay wala pong nag-present from NCR kasi ang plano po namin ay separate na webinar ang gagawin na magpipresent po ang NCR LGUs. Kasi iba po ang marami pong pagkakaiba ang mga eksperyensya ng NCR LGUs sa mga nasa probinsya po. Ganon din po ang BARM, hindi pa po na isa lang sa ating webinar ang LGUs sa BARM, bagaman po at may mga na-identify na rin kami na mga LCS po dyan na alumni na rin po ng CLRG training. So bale, maganda na po ang naging kombinasyon at representation po ng mga nag-present o nag-share po ng experiences ng mga LCS buhat sa CAR, Regions 1, 2, 3, 4B, 5, 6, 7, 8, 9, 10, and Caraga ay nakapag-share na po. At dinadagdag din po namin dito yung sa region, sa ibang regions, kasi po nag-webinar din po ang CLRG ng isang separate na webinar na all-female LCS po. Kaya total of 32 LGUs na po ang na-represent o na buo po ng aming webinar. At ang next step naman po na gagawin ng CLRG, habang papahinga lang po muna sa webinar na ito, ay i-collate po namin yung experiences ng mga LGUs na nag-present at gagawa naman po namin ng documentation. Nang sa gayon po ay magkaroon naman ng output para pong research ng CLRG. Kaya yung pong mga nag-present ngayon at saka sa mga nakaraang webinars po, ay babalik pa po kami sa inyo para sa mga karagdagang impormasyon na idadagdag po namin pag ginagawa na po namin o paggagawin na po namin yung documentation. Yun po ang gagawin namin na magandang o konkretong output nito pong webinar series na ito. So total of 11 provinces po, 11 municipalities, and 10 cities po ang gagawa namin ng comparative analysis o report kung ano po yung mga naging experiences ninyo, ano yung mga best practices na nagawa po ng mga LGUs na ito. So bale yan lamang po siguro at magpapasalamat po ako siyempre sa partner ng CLRG, ang LVGP, at sa mga vice governors din po na present po dito sa 6th edition natin. Of course, ang ating National President po ng LVGP, si Vice Gov Karen Agapay. Andito rin po ang National Chairman, si Vice Governor Boy Kim po ng Aklan. Kasama rin po natin sina Vice Governor Atay, Vice Governor Garcia, Vice Governor Tomas, Vice Governor Ariosa, alumnus din po ng aming training, Vice Governor, of course, ang atin pong reactor ngayon, si Vice Governor De Peralta, Vice Governor Almonte, Vice Governor Segura, Vice Governor Lambino, alam ko po, nag-training din po kayo sa amin. Ganon din po si Vice Governor Alano, alumnus din po namin, Vice Governor Caneha, Vice Governor Panotes, Vice Governor Noveras, at Vice Governor Garin, alumna din po ng aming training. Ang isa pa pong dahilan kung bakit po medyo ipapark muna natin pansamantala ang webinar series ng CLRG at LVGP, ay medyo tututukan din po muna namin yung capacity development program para sa LVGP. At the same time, kasi kailangan na po itong umusad, mag-election na po, alam naman nating lahat na may mga restrictions sa mga capacity development program sa pag-implement po niyan. At may mga customized online trainings na rin po kaming gagawin kasi simula po ng mag-pandemic ay may mga LGUs na rin po na gustong mag-training ulit sa UP, may mga bago, may ganun din po yung mga personnel na mga bagong nauupo kasi may mga nag-retire na raw sa sanggunian nila, yung mga department heads, so gusto pong mag-training. So doon lang po muna medyo yung capacity development program with LVGP. So tuloy-tuloy po yung partnership between LVGP and CLRG. And paiigtingin din po namin yung partnership namin with other LGUs. Karamihan po ay nanggagaling po dyan ang mga alumni ng CLRG. Kaya customized online training din po ang gagawin ng CLRG para doon po sa mga requests sa amin sa CLRG. So maraming salamat po at kay Dean Dan Sagil, maraming salamat din po sa patuloy ninyong suporta sa mga activities po ng CLRG. Maraming salamat din po sa mga participants na patuloy na tumatangkilik po sa webinar at sa iba-iba pong mga activities ng CLRG. At siyempre po sa aming mga kasamahan kong staff, patuloy na pinalalakas po natin ang ating samahan sa pagpapaayos pa ng pag-implement po natin ng mga webinar series at habang magpapatuloy tayo sa pag-implement ng customized online trainings and other programs for local government officials. Maraming salamat po sa inyong lahat. Mayor V, maraming salamat po. Alam ko po na kayo ay medyo na-stress. At maraming salamat din po kay Mayor Sel ng New Lucena. Naging malaking tulong po kayo nung nag-research din kami sa Iloilo. Maraming salamat din po Mayor Kirk Asis. May mga suki po kami na opisyalis po ninyo dyan. At mukhang may gagawin din po kami para sa inyong LGU. Maraming salamat po kay Vice Governor De Peralta. Alumnus din po namin ang inyong Vice Governor, ang inyong kasalukuyang Governor, si Governor Steve. So maraming salamat po sa lahat ng mga naririto, nag-participate po. Hindi po ito ang huli nating pagsasama o pagkikita. Pagpapatuloy po tayo at muli po yung mga mayors po natin dyan nag-present. Babalik po kami sa inyo, mangungulit pa sa paghingi po ng makaragdagang impormasyon kung ano pa po ang inyong mga ginawa at planong gawin. Kasi yan po ang ating direksyon ng pag-manage natin dito sa COVID pandemic. Hindi po dito natatapos kasi hindi natin alam kung hanggang kailan itong pandemic na ito. So patuloy po ang ating partnership. LBGP, lahat po ng mga local officials, lalo na po yung aming mga alumni. Maraming salamat po. Magkita-kita po ulit tayo sa mga susunod na online activities, events ng CLRG and CPAG.
Okay.
Okay na, Gerard?
Ako, maraming salamat po. Bago po ako magbigay ng final reminders para sa mga participants, may I request everyone to open their cameras para sa picture taking. Ngiti lang po kayo ng 1 to 2 minutes as our staff takes your picture, isi-screenshot po namin siya. Okay. So, 1, 2, Paki. Yan po Yun. Marami po magandang faces ngayong webinar. Smile. Konti pa po. 2, 3. Okay, thank you po. Maraming salamat. Okay. So, bago po kayo umalis, magbibigay lang po ako ng mga final reminders para sa mga taong gusto makakuha ng kanilang certificates at makakuha ng kopya ng PowerPoints po ng ating speakers. Okay. Participants who completed 70% of the total webinar time and submitted their feedback form will receive certificates of participation and copies of the speaker's presentation. Yung mga certificates po sa kayong mga presentations, ibibigay po namin sa June 8 or beyond to give us time to collate and work on them. Please don't forget to take your attendance before leaving this webinar. Okay, ito po yung feedback form. I-paste ko din po sa chat para madali pong maklik or kung gusto nyo gamitin ang QR code. Ayan po. Kunin nyo na lang po itong...
Hindi ko alam kung era ko pa paano.
Ayan
nyo
lang
daw
po.
ang feedback form.
I-mute ko lang po uli yung mga
screenshot na.
Extra. So, sandali lang po. Sandali lang po Pwede po pa-mute muna uli lahat ng ang microphone. Okay. So, habang sinasagot niyo po ang inyong feedback form, i-play na po namin yung aming closing ceremony, UP naming mahal. Okay. So, sandali. Sandali lang po. I-mute mo rin po muna ako ng mga Ayaw magpa-mute. Hindi. Okay, okay na. So, lang po. Share screen. Sound. Viewing namin. Okay, maraming salamat po. We will keep the room open for 10 minutes more para po sa mga taong gustong magsagot ng feedback call nila. So, mag-play na po ako ng music para lang naman po lang dead air. Paalala lang po sa mga kukuha ng certificate, the deadline for submitting the feedback form is until May 31, Monday, 6 p.m. So bago po mag 6 p.m. ng Lunes, pwede niyo po gawin ang inyong feedback form.